I'm Julie Barkey with this Senate update. A bill that would reduce the tax on cigars by roughly $3 per cigar was debated for nearly an hour in Thursday's Senate Taxes Committee. We pick it up with Senator David Senjum describing his legislation.
You know, I'm here, and I thought long and hard, Mr. Chair and members, about whether or not to even get involved in this bill. And I would just say, if we're here to talk about the health effects of tobacco, we all know what they are. I don't think we need to do that. I wouldn't have gotten involved in this bill if we were to talk about the health effects of tobacco, because that's a foregone conclusion. We know we are. I quit smoking 49 years ago. It's not good for you, et cetera, et cetera. But nonetheless, I think it is important to talk about the tax policy.
If I could interrupt you, just brief, I want to reinforce to the members, we're really here for the tax policy of this conversation, as Senator Senjum just commented about. Try to keep our
exactly.
Senator Senjum.
Mr. Chair and members, the tax policy, I think, is a critical thing to talk about here today, and whether or not in the case of these cigars we use tax policy to control behavior, or whether or not tax policy, in my mind, as it appropriately ought to be applied, is to equitably fund government. And I think in this case, perhaps we've drifted a little bit and are using tax policy to, in fact, try to control behavior. Mr. Chair and members, this bill is rather simple, actually. It strikes the so-called hand-rolled from the definition of a premium cigar, meaning a cigar could potentially be machine-rolled, and it reduces the reduces the maximum excise tax imposed on distributors of premium cigars, and the tax would be the lesser of 95% of the wholesale price, or now 50 cents as opposed to $3.50. And I would say, Mr. Chair and members, as I again thought about this bill, if we're going to, tax according to what we think proper behavior should be in terms of certainly healthcare consequences and all that goes along with that, there are certainly other things which are part of our life, which are legal, which do impose healthcare consequences at times. Things as simple as automobiles. Motorcycles. You can go to any hospital in Minnesota and it has a rehab unit, and you can see people that drive motorcycles which have been involved in crashes and which are suffering medical issues. We can talk about alcohol if we want to. Should that be, frankly, taxed at the same level that these premium cigars are? And we can go down that road if we want to tax according to our wishes to control behavior. But if we want to try to be equitable about tax policy and apply some level of fairness to how we tax things, whatever they might be, then I think this is a good discussion to have today. Mr. Chair and members, I want to bring forth and call forth my witness, Mr. Wolk. He's a cigar store owner. I've just met him this morning, but he's, I think, well-versed in talking about this issue from the standpoint of a business case.
Senator Eaton, did you want to add something first? Mr. Wolk.
Thank you, Mr. Chairman. Good morning. My name is Mark Wolk, and I own and operate Stogies on Grand, a premium tobacco shop. I represent the third generation in our family involved in the premium tobacco business in Minnesota. Stogies has been at the same location for 18 years. We are a small business with real ties to our community, and we are part of the fabric that is historic Grand Avenue in St. Paul. I'm here today to ask you to change our tax cap to 50 cents per cigar to align with our neighboring states. There are just a handful of premium tobaccos in Minnesota, and most of us employ 10 to 12 people. We are retailers with the Minnesota tax distinction of being distributors since we purchase our products out of state. We are currently being burdened with the highest tax in the country at a rate of 95% of cost, or $3.50 cap per cigar. Our neighboring states, such as Wisconsin and Iowa, are currently at a 50-cent cap. We have to compete with our neighbors and the internet, who sell a box of 20 cigars for $60 to $90 less than we can. That leaves both our store and the state of Minnesota at a huge disadvantage, and ultimately the losers in revenue. People come to our store to try one or two cigars, then shop out of state or on the internet for more favorable prices on box purchases. Each year, our buying power diminishes because, unlike other industries, we have to pay the monthly tobacco tax before our product sells. Starting in January of 2015, a loophole in the statute was found, and we were required to begin paying 95% tax on our freight charges. Yes, you heard that right. That is 95% tobacco tax on the freight. This added another 50 cents to every cigar in that box of 20. Premium tobacconists are purveyors of fine products just like wine and coffee, and our customers are similar. We are a gathering spot for people of all walks of life from every social and economic background. People enjoy a fine cigar to celebrate happy and momentous times in their lives. Our store has never had an underage violation. We do not promote to young people, nor do we encourage that business. Our business should never be lumped together with hookah, glass pipes, or discount cigarette sellers. When I've heard others come and talk about tobacco issues, they keep pointing out that underage kids are smoking less. That is what we all want, and goes to our point that premium cigars have never and will never go after that demographic. We are 100% against underage smoking, and we will always be for strict enforcement, not overtaxation to deter their behavior. I very much appreciate you allowing me to speak to you today. Both the retail tobacconists and the state of Minnesota could be the beneficiaries of a change in the tobacco tax and cap. Thank you.
Questions, members? Senator Nelson.
Thank you, Mr. Chair. Mr. Wolk, thank you so much for coming today, and I always appreciate when businessmen and women take time out of their daily schedules and all the things you do as a small business owner. I know you wear a lot of hats, to come and testify before us about bills that are important to you. And I understand your comments were very solely focused on the cost of the tax. I have a different question for you, and that has to do with actually the premium cigar itself. And those are all hand-rolled, if I understand. Is that correct?
That is correct.
Mr. Wolf.
Thank you. And
Senator Nelson.
oh yeah, and thank you, Mr. Chair. And then my next question is, would you envision that premium cigars would ever not be hand-rolled? In other words, would they still be considered in your mind a premium cigar if they were not hand-rolled or hand-constructed?
Mr. Wolk.
Thank you, Senator Nelson. The way we define a premium cigar as such right now, hand-rolled is part of that same definition. Yes, I envision hand-rolled and premium in the same breath.
Thank you.
Senator Nelson.
I'll save my other questions till later. Thank you very much.
Senator Eaton.
Thank you, Mr. Chair. My question is, if you remove the hand-rolled requirement, wouldn't you expect that machine-made cigars would declare themselves as premium to get the tax break?
And Senator Nelson, members, I would draw your attention to, it's been pointed out to me on page 1, line 9. This removes the hand-rolled definition and goes to hand-constructed.
That's my concern,
Yes.
Mr. Chair.
Senator Eaton.
Were you going to answer my question?
Mr. Holton.
Mr. Chairman, Senator Eaton, Court Holton, Cigar Association of America, which is the manufacturers. What makes a premium cigar is the quality of the cigar. And you've all seen them. They're about like that, and they are the most expensive cigar leaf on the market, and they're carefully made. Presently, there is machines that can start creating these premium cigars, and so if that was not in the bill, it wouldn't be a big deal, because we're looking more down the road to the future on that. There's very little of that happening right now. But what makes the premium cigar a premium cigar is absolutely the top of the line leaf that you can purchase at auction.
Mr. Chair.
Senator Eaton.
So you don't think that if I owned, say, I produced Swisher Sweets that taste like cherries, that, and I could claim on the label that I had premium tobacco in it, and without the requirement of hand-rolled, that I couldn't get that tax break?
Mr. Holton.
Mr. Chairman, Senator Eaton, it would make a difference as how this committee, wrote that tax law. There's more than the hand-rolled in your present definition of a premium cigar. And a little cigar, under your present definition, even if you removed hand-rolled, would not qualify for tax purposes as a premium cigar.
Thank you.
Senator Reinhardt.
Thank you, Mr. Chair. And I'll preface my question by saying, and I don't know, Mr. Chair, that you want to have this today, but I do think there is a great policy conversation to have around not just tobacco, but other products like alcohol that we have tax policy with. It's always sort of puzzled me, especially on tobacco, that I think we have come to rely on it for general fund purposes, but my view has always been that the tax was meant as a behavioral disincentive, but I don't think that's the conversation for today. My question, Senator Senjum and/or testifiers, is I'm trying to understand whether hand-rolled or not hand-rolled. I get the concern of our retailer who's here today about the differences with our neighboring states, yet it strikes me as almost identical to the conversation we had on the previous bill. And it strikes me as almost identical to any number of bills we see in commerce on some other products where we do have substantial differences with neighboring states, sometimes higher, sometimes lower. Why are these special? Why are these the one product we want to equalize versus any of the myriad others that we might be looking at?
Senator Senjum. Mr. Holton.
Thank you, Mr. Chairman. Senator Reinhardt, and I'll just go through to answer your question briefly what some other states are doing. And most of the states do have a special category for premium cigars, and that has a lot to do with the cost of premium cigars. For instance, if you had a $400 box wholesale of premium cigars, which would be really a really good cigar, the tax in Minnesota, and that doesn't even include all the tax, would be at least $380. So when you're putting this together, if you think that the people that buy those and have discretionary income are going to pay $380 in tax alone for a box of cigars when they have options, you're not dealing with reality. Now, 10 states have cigar caps at or near 50 cents, and 4 states charge tax premium cigars per cigar, like 4 cents a cigar or something like that. 15 states have the flat tax like we have percentage-wise, but it's so low that a cap wouldn't make any sense. And no state has a cap of $3.50. We're far and away the highest. Iowa and Wisconsin have at least mid-range tax on tobacco products, but they have a 50-cent cap per cigar on cigars, because otherwise what has happened here would happen there. If you want to buy good, high-quality premium cigars and you live in the metro area, go to Hudson, Wisconsin. There's a booming business. They got plenty of stores, and they have a 50-cent cap, and that's where our metropolitan sales are today. We tried $3.50. The bill started out at 50 cents. We got to a $3.50 cap to see if that would work. It didn't. We're suggesting let's try 50. If that doesn't work, the tax committee will be in session every year and a different figure or plan.
Mr. Holton, just so I can understand your testimony, you talked about a $400 box of cigars and the tax being $380. How many cigars are in that box?
20.
So wouldn't that be $70 of tax?
Pardon me?
Wouldn't that be $70 of tax because it'd be 20 cigars times $3.50?
That's correct.
Oh,
That's correct,
yeah,
yeah.
yeah, you're right.
get
I was
the 95%
figuring the
of wholesale,
95%.
yeah, But it's capped.
So my figure was wrong, but the idea is
The idea
still
is the same.
valid.
I'm just double checking. Senator Reinhardt first. Senator Reinhardt.
Thank you, Mr. Chair. Just a couple follow-up comments. And I still sort of struggle with why these are different in the big tax policy debate, and that's I guess what I'm looking for. To me, we have these two underlying issues that probably warrant further conversation. One is, what is the purpose of our tax policy around tobacco? Is it to provide general fund dollars, in which case I think that is one argument for how we tax products. The other is, do we want people to not smoke? And I think that's a different tax policy. The other is, and it's one we've dealt with, Mr. Chairman, many online shopping, and how do we make the field fair for our bricks and mortar businesses on Main Street or Grand Avenue in this case. And sir, you're in that boat, you know, and we have the Best Buys and businesses that are in that boat. And, you know, we took the step a couple years ago to tax the online sales, at least through places like Amazon, to try and equalize that field. But, you know, we still have, I mean, I'm a service member, and I know people that will go to the Navy Exchange to buy bigger products and then not pay any sales tax because it can be a substantial savings. So, I mean, unfortunately, I think you helped bring forward just a larger issue that we just have to continue to try and figure out how to solve, because otherwise as you said, our active small business people that are in our communities, participating with their neighbors, being good civic and corporate citizens, are really at a disadvantage.
And Senator Reinhardt, I don't know exactly what the future, there was a bill introduced this week, I believe, that deals with vaping. And it's partly driven by the 95% of wholesale tax that's on these OTP, other tobacco products. And so I don't know if we're going to see that bill or not. I don't know what the future lies for that. But this conversation is around, and it's being driven by this 95% of tax on OTP products. Senator Eaton.
Thank you, Mr. Chair. Senator Senjum so I guess my question is that, do you think that the tobacco products, the cigars, are less carcinogenic than cigarettes? I mean, is there a reason you want them to be more accessible and cheaper?
Certainly, Mr. Chair, Senator Eaton, of course not. They're certainly, from a health hazard point of view, I don't think anybody would debate that they are hazardous. They also are legal, and I think, as I talked earlier, let's think about taxing according to equitability and fairness, as opposed to trying to control behaviors.
Mr. Chair?
And Madam Chair, if we're going to, Mr. Chair, if we're going to tax according to controlling behaviors, then, you know, I don't advocate that, but, you know, there's a road we can go down if we want to do that, because there's lots of other things that are legal that frankly have medical consequences.
Senator Eaton.
Thank you. Which you bring in the whole policy issue, and which is why I have to say I cannot support making any tobacco product cheaper. Cigars are known to be more carcinogenic than cigarettes, and I don't know that I want to spend $2 million on getting rid of the tax on cigars. It's a pretty high price in our general fund budget.
Senator Senjum.
Mr. Chair and Senator Eaton, you know, I can respect that. If you are of the bent that you want to use tax policy to control behavior, that's certainly your privilege as a member of the Senate. And I'm just here to, I think, have the debate. You know, what is the proper tax policy on this item or a lot of other items? So I think this is the place we have to have it. If we don't have it here, it doesn't occur anywhere. So.
And Senator Senjum, we've got a list of testifiers that are going to testify in opposition to your bill, so I think we should move on to some of that testimony. Thank you, Mr. Holton and Mr. Ms. Waldock and Dr. Mattson.
I have some handouts for committee members.
Thank you.
Yes. So thank you, Mr. Chair, members of the committee. I'm Janelle Waldock, and I'm the director of the Center for Prevention at Blue Cross and Blue Shield of Minnesota. And I'm here today speaking on behalf of the Raise It for Health Coalition, which is a coalition of many health and nonprofit organizations that advocated for the tobacco tax that passed during the 2013 legislative session. We believe strongly that tax policy is health policy because of the strong implications that the decisions made in this context have on health, which is why we're weighing in on this bill. The coalition has significant concerns with Senator Senjum's bill. It would effectively walk back progress that we have made from the legislation that you already passed in 2013. Research released earlier this year demonstrates that the tobacco tax is having a powerful and positive effect. It's motivating smokers to quit and preventing kids from picking up the habit. Further, the tobacco tax is projected to save billions of dollars in healthcare costs. These are both significant wins for our state. While it's true that cigarettes are more commonly smoked than cigars, that's no reason to apply a whole different set of rules to them. They are no less addictive and no less harmful. There's no logical reason to give them a special preference. The new premium cigar carve-out was created in 2013, and before that time, cigars were taxed just like all other tobacco products. We were opposed to the change at that time because over and over, we have seen how the tobacco industry manipulates product design to take advantage of loopholes and special definitions. For example, you may remember how the industry manipulated cigarettes as little cigars to take advantage of a much more favorable tax classification. There's no reason to believe that today's issue is any different than that. Don't be fooled. The word premium is a bit of a misnomer, as you've already discussed in this hearing today. It simply refers to the construction and the packaging of the product. If this proposal moves forward, the maximum tax on a cigar, on any cigar, will be reduced from $3.50 to 50 cents, an 85% cut. The tax on a $4 cigar would equal 50 cents. The tax on a $100 cigar would equal 50 cents. I work to reduce smoking and to create healthier Minnesota communities. So from my perspective, I just have to ask, how does this make any sense? This proposal represents bad health policy and bad tax policy. And in short, there's only one entity that this bill will benefit, and that's the tobacco industry. It's bad for everyone else, and most importantly, it's bad for Minnesota. Thank you.
Thank you. Dr. Madsen?
Mr. Chairman, thank you.
Would you stay in case there's questions?
Yes, I'm happy
Mr. Chair,
to.
I do have a question for you.
Okay, we'll get that right after Dr. Madsen. Dr. Madsen.
Thank you, Mr. Chairman. My name is Dr. Lisa Matson. I reside in Plymouth, Minnesota. And I thank you for allowing me to be here today to voice my strong opinions against Senate File 1894. We live in a society where cigars are very much glamorized. It's already been stated here that they are used for celebrations. We think of cigars as being associated with successful, powerful people. And this has an impact on our youth and some of our poor members of society who strive to be more powerful and successful. But cigars are not benign. By definition, a cigar is made up of multiple forms of tobacco wrapped in a premium tobacco leaf. They are 100% organic, which I've heard as an argument, but organic is not necessarily meant to be healthy. This is a classic example of how marketing is meant to sometimes just mislead people. Nicotine, which is part of all tobacco, along with 19 other carcinogens that is part of anything that has tobacco, these are all bad things for us. Nicotine is the addictive part, and then there are another 19 carcinogens in any type of tobacco. We absorb nicotine through our lungs, but we also absorb it through our cheeks. So even when people inhale cigars, which they oftentimes think is healthier, you're still getting these chemicals into your system. I'm a gynecologist, and some people may wonder why this is important to me. For women, the #1 cause of cancer death remains lung cancer. But another very unknown fact is that when women get nicotine into their systems, we will find very high levels of nicotine in, of all places, a woman's cervix. The human papillomavirus that causes cervical cancer, in very simple terms, loves nicotine. So women who use tobacco products are more likely to develop cervical cancer. And the same mechanism we're finding is more and more common in the reason for increase in head and neck cancers that we're seeing in tobacco users, whether they're smoking it or chewing it or just letting it sit in their mouths as vapor. Minnesota has always been a very healthy state, and right now we have our lowest level of smoking ever, and we need to aim to make that even lower. We do know that by increasing taxes, we have decreased the number of smokers. We had a white paper that was published just this past February that found major decreases, and we know that over 60% of people who quit smoking or decide not to cited the cost as an example of why they may have not smoked anymore. Tobacco is tobacco. All nicotine comes from tobacco, and we need to do everything we can to minimize use. As leaders, we need to endorse healthy lifestyles in our constituents and in my patients. We need to encourage exercise, healthy eating, and we need to do everything we can to discourage tobacco use. So I strongly urge you to leave the tax on premium cigars where it currently is. Senate File 1894 only serves to move the health of our state backwards, not forwards. Thank you very much for your time.
Senator Gazelka.
Thank you, Mr. Chair. Real quick, just an assessment. You can confirm whether this is true or not, because we're talking about cigars, not cigarettes, but it's my understanding that kids don't really, the cigar is not the entry-level tobacco, it's the cigarettes, which is why when the prices went up, smoking went down. So I want you to confirm, number one, that is true, that it's not really cigars. And secondly, as the taxes have gone up on tobacco, cigar use, I don't think has gone down. My guess is that it's gone up, and so that there's really not the correlation that there was with cigarettes. And so I guess I need to, if you don't agree with that, I need to know why.
I'm not sure that we have any
Dr.
data
Mattson.
on cigar use. Sorry.
Dr. Mattson.
I'm not sure we have any data on cigar use, and you may be correct there, but I would argue that anyone who's over 18 still has, they're not entirely mature adults yet. And if you go to the fraternities and sororities at University of Minnesota, having a cigar to feel like you're successful and powerful is not an uncommon thing anymore. So while it may not be in 7-year-old hands, it's still in young people's hands. And if we decrease the price on a $6 cigar down to $3 by taking away that $3 cigar, it's going to be more accessible to even our college students. And I think we need to discourage that.
Thank you. And perhaps if some of the next testifiers would know the answer to that, that would be helpful. Anything else, members? Thank you. Thank you. Dr. Lupker and Ms. Morris. And to the tax issue, please.
Yes, Chairman Squee and members, I am Russell Lupker. I am a cardiologist at the University of Minnesota. I'm also Mayo Professor of Public Health and an American Heart Association volunteer for over 30 years. I hate to say how many years. I appreciate the opportunity to join Dr. Mattson and express my strong disapproval for Senate File 1894, along with any effort that seeks to provide tax relief to the tobacco industry. I personally testified here before the bill increasing taxes on tobacco 2 years ago, and the result, I have to say, has been phenomenal for the health of Minnesotans. Research demonstrates that raising the price of tobacco helps people quit, prevents youth from starting, and saves lives. Just this year, we saw the percentage of adult smokers in Minnesota fall to 14.4%, among the lowest in the country. Our efforts to make all public spaces tobacco-free and the issue of secondhand smoke has made significant progress, and at the university we have declared our areas smoke-free, both indoor and outdoor. Raising the price of tobacco plays a role, as does providing cessation treatment for people who are addicted. So why would we want to undermine this and these efforts by giving a tax break to premium cigars? So what are the health effects of cigars? Actually, the facts are well known and not not in debate. Cigar smoke, like cigarette smoke, contains toxic and cancer-causing chemicals, harmful to both smokers and non-smokers who are around them. Actually, cigar tobacco has a higher level of cancer-causing compounds, nitrosamines and tars, than cigarettes do because of the way it's cured. Cigarettes or cigar smoking causes oral cancers, the lips, the tongue, the mouth, the throat, and cancers of the voice box, the esophagus, and lungs. For those of us who care for patients that have these cancers, I can tell you, this is a horrible way to die. So, a premium cigar, as we're discussing here, can have around 20 grams of tobacco in it, the same as a whole pack of cigarettes. The tax on a pack of cigarettes is $2.90. $3.50 is not much different from that. Same amount of tar, same amount of nicotine as a whole pack. Some say cigars are safer because you don't inhale. You still get the oral cancers, but people from our studies who have also smoked cigarettes, and many use cigars to cut back or switch back and forth, if you smoke before you inhale, and you get the same effect, like heart attacks, my interest, as you would if you smoke cigarettes. So in summary, there's a lot of work that you as a committee can do in this session that will benefit the health of Minnesotans, but including Senate File 1894 in your final tax bill is not one of them. The harmful effects of cigar smoke are well known and not debated. I strongly encourage you to stand up to the tobacco industry for the health of Minnesotans and not give a tax break to premium cigars. Thank you for your attention.
The only thing I would say is this doesn't impact the tobacco industry, it impacts our local retailers. Ms. Morris.
Thank you, Mr. Chair and committee members. My name is Michelle Morris. I'm with the American Lung Association in Minnesota. I have a master's in public health from Columbia University. And as a public health professional, I believe it's important to draw your attention to the Health in All Policies movement. It's happening across the country. And this is the recognition that nearly all policies influence health, for better or for worse. So please consider this as you decide the impact that you want this bill to have. Some may argue that we're too hard on tobacco in the state. I'm not one of them. I'm the first person to say love the smoker, hate the smoking. Minnesota has a history of being tough on tobacco, and we're proud of it. The first smoke-free workplace, the tobacco lawsuit and settlement, a free quit plan program, the wildly popular freedom to breathe, the tobacco tax, last year's e-cigarette policy. Together, they are what has driven our smoking rate down and saved untold numbers of kids from smoking. We should be celebrating these policies, not undoing them. And yet what this bill is proposing is what we've seen so many times from the tobacco industry, a chipping away at the policies that protect the people and jeopardize tobacco company profits. So who should we let set our public health standards? Greedy people profiting at the expense of others' pain and early deaths? Or public health experts promoting health for all based on best practices? Policies like tobacco taxes are popular statewide and are proven to work, both in decreasing healthcare costs that we all pay for and by encouraging smokers to quit. As lawmakers, you are here to represent the people and their interests, not the lobbyists of a dying tobacco industry. As a public health professional who has lost a loved one to tobacco, my interests are always in favor of policies that support smokers in quitting, protect youth from exposure to smoking, and prevent youth from being targeted by big tobacco. I ask you today to stand up for Minnesotans, for our public health, and for our youth. Be proud of what Minnesota has achieved, and keep tobacco prices high in our great state. Thank you.
Any questions, members? Seeing none. We have two more testifiers for the Raise It for Health Coalition. We've already heard from them. So if Ms. Shamba and Ms. Hoax could come forward, but keep it brief. We've already heard from your organization. Thank you very much.
Mr. Chair, to your point, I just wanted to say, we're here to talk about the tax policy and not talk about the bad effects of smoking, because I think we all recognize that. And so if there's, I would hope that our testifiers would keep their comments to the tax policy.
Thank you, Senator Hartman. I tried to remind people to do that. Welcome to the Tax Committee. Ms. Samba? I'm sorry if I'm mispronouncing your name.
Mr. Chairman, members of the chamber, I am Sheku Samba. I live in Brooklyn Center. I am a member of Multicultural Advisory Council in Brooklyn Center, working with the police and the community in order to promote a healthy relationship. I am proud to live in Minnesota, being one of the healthiest states because of your relentless efforts to put some common sense policies in place. And despite that, it is clear that the burden of smoking falls disproportionately on minority populations in Minnesota. Many ethnic groups use tobacco at a much higher rate than the general population. Cigar in particular are fashionable products. They are used as, they are considered as much of the status product, particularly among men. Higher cigar prices result in decreased consumption, but if you make these products cheaper, it will be easier for price-sensitive smokers and much more youth also to buy and use these products. Cigars cause cancer and many other fatal diseases. And minority populations have higher disease disparities. Such preventable public health tragedy does not occur by accident. It emanates right from the policies that are made from here and the manner in which tobacco industries targets our communities. In Brooklyn Center, I helped pass a policy that keeps cigars out of the hands of children and other people. I'm very proud of being part of that process. Since price has a profound effect on the smoking prevalence, especially among youth, I therefore urge you to reject this proposal today and continue to work and continue to make progress in reducing secondhand smoke exposure, disease, and deaths caused by tobacco epidemics. Thank you.
Thank you, Mr. Samba. Sorry for not getting your gender proper.
Sheku Samba.
Sorry about that. Ms. Hoax.
Hotep, Mr. Chair, and committee members, I appreciate this brief opportunity to provide testimony this morning. My name is Ora Hoax, and I am an alumna of the Leadership Institute to Advance Minnesota's Parity for Priority Populations. We are working to improve health equity for diverse communities in our state. As a member of a community that experiences more harm than the general population from tobacco, that uses tobacco more than the general population, that has higher rates of lung cancer, heart disease, and other diseases caused by tobacco, I had to ask myself, why would anyone ever support making tobacco products of any kind cheaper? Obviously, the tobacco industry has a reason. If tobacco products are cheaper, more people are going to buy them. History shows us that manufacturers and retailers manipulate their own prices, offer coupons and discounts, and target specific communities and income levels, all to keep people smoking and keep people buying. The repeal would be good news for them. Just a couple of weeks ago, there was a report showing...
Senator, just a second, Ms. Hoax. Senator Thompson.
I think you have been very gracious in giving a fair amount of latitude. I'm hearing nothing even remotely close to a tax policy discussion in this right now.
Senator Eaton.
Thank you, Mr. Chair. While I understand your point of view, Senator Thompson, these are citizens who have come in to speak on their concerns from their community, and I think we need to hear them out.
Continue, Ms. Hoax. Continue, please.
the repeal would be good news for them. Just a couple of weeks ago, there was a report showing that tobacco companies are some of the highest spending lobbyists in Minnesota. So it's clear this is their favorite type of legislation. And I suppose it's also good news for a certain type of man who likes to smoke big cigars. Big cigars have a symbol of wealth, power, and status for over 100 years. A cigar can make a man feel powerful and important. It's true. It can kill you, but it's true. But what you might not realize is that you don't have to be wealthy to afford these cigars. Some of these so-called premium cigars can be bought for about $5. That's $5 now, before the tax break. If this bill passes, you will be able to buy them for about half that. There's no question that's going to get many people smoking. No question. Look at it this way. The average price of a pack of cigarettes in Minnesota today is about $7.50. In some parts of the state, it's even higher. If this bill passes, you'll be able to buy a big, cheap cigar for about $2.50. And who do you think is going to be hurt most by that? I can tell you, it's going to be men in my community. It's going to be men who are trying to catch up in our society, who wants to seem successful, seem affluent, seem powerful, authoritative. And it's going to be their families, their wives, their parents, their children who have to breathe in cancer-causing second-hand smoke. You may think supporting this proposal does no harm to anybody, but it makes tobacco products cheaper and push them down into the reach of those who might not otherwise be able to afford them. Make no mistake, you are adding to the overwhelming burden that already bear from the deadly problem of tobacco use. I ask you to help improve health equity by opposing this policy. Asante Sana, and thank you again for allowing me to testify. And thank you, Sister Edith.
Thank you both for your testimony. Thank you very much. Mr. Narum? Ms. Narum, thank you very much.
Thank you, Mr. Chair and members of the committee. My name is Kayla Narum. I am a volunteer with the American Cancer Society Cancer Action Network. I'm originally from Andover, Minnesota, and currently reside in Minneapolis. I spoke before this committee 2 years ago as you debated the merits of an increase in Minnesota's tobacco tax. I relayed the story of my father, who I lost to esophageal cancer from smoking just 1 week after my 14th birthday, and the tremendous toll that it took on me and my family. Because of tobacco, he wasn't there when I graduated from high school or college. He wasn't there to guide me as I entered the workforce, and he won't be there someday to dance at my wedding. I told the story to remember my dad and hopefully in some small way be a part of making sure no other family has to go through what I did. 2 years ago, this committee listened to the facts and made a wise decision. You heard about the potential to reduce smoking rates and raising the price of tobacco. You learned how high prices keep kids from starting and how less smoking makes it a healthier state and reduces healthcare costs. And so you voted to increase the price of not just cigarettes, but all tobacco products, including smokeless tobacco and cigars. 2 years later, we know the tobacco tax is working. Smoking rates are at the lowest level ever reported for both adults and youth in every age group. Why would anyone want to reverse this success? We cannot talk about taxes in a vacuum. They are part of a larger issue. Cigars contain the same cancer-causing agents as cigarettes and emit more secondhand smoke. Unlike cigarettes, smokeless tobacco products and cigars come in candy and fruit flavors that make it easier for kids to take the first puff. Combined with lower prices, these products are attractive to children and teens. I'm here today to remind you of the wisdom that 2013 tobacco tax increase and encourage you to protect the integrity of this important public health policy. Rolling back this tax will only do two things: make cigars more affordable for cash-strapped teens and increase the cash flow of tobacco companies. Please do not weaken the law and create a loophole for cigars. Choose the health of our community and our kids instead. Thank you.
Thank you very much. Any questions, members?
Mr. Chair,
Senator
just a
Urban.
quick question. Ms. Narum, I'm sorry about the loss of your father.
Thank you.
Do you think that tobacco products should be illegal in the state of Minnesota?
Ms. Narum.
I believe they should be. I don't feel that anyone should be using tobacco products. It has no benefit as far as I can see and has only caused a lot of hurt and pain for my entire family.
Thank you.
Thank you very much.
Thanks.
Seeing nothing else from the committee, Senator Senjum. Senator Thompson.
Thank you, Mr. Chairman. I just want to point out a couple things that have, I think, been lost in this discussion. One is people make an individual choice to smoke. And certainly many, many years ago, the health risks were not known. In fact, we all understand that they were covered up. They're known now. I'm 53 years old, and since I was a little kid, I have been inundated with information about the dangers of smoking. It is still an individual choice. People choose to do it. Secondly, if the cardiologist were to continue to testify, he can certainly verify that there are lots of things that are unhealthy for us and for our cardiovascular condition other than smoking. I have too much of a penchant for pizza, and I'm sure that that's not a good idea. When we go down this road of, as I apologize, I've forgotten the lady's name that was in public health and went to Columbia, indicated that the public health experts know better. Where does that stop? We have public officials in New York trying to control the size of beverages that we drink. I read the other day, and of course now every health threat that comes up, it's, quote, the new smoking. I read that being sedentary is, quote, the new smoking. That if you sit in a chair too long every day, that's as dangerous as smoking. And so the concern I have is we don't talk at all about the fact that the individual who chooses to smoke is making a decision. I choose not to smoke, but I don't think other people should be prevented from smoking. And then the second thing is, where does this stop? Sugar is dangerous, fat's dangerous, excess carbohydrates are dangerous, sitting too much is dangerous, too much stress and anxiety is dangerous. And if we accept the premise that it is not the individual's responsibility to monitor those things in their lives, there is no stopping point. The nanny state goes forever. And that, I just feel that needs to be said, because all we heard today was when people smoke, it's somebody else's fault, and that we just should assume and accept the premise that it is society's responsibility to decide what I inhale or ingest rather than mine, and that's just a dangerous road to go down.
Members, I gave a lot of leeway to the public, but I do expect the committee to focus on the tax issues. Senator Nelson.
Mr. Chairman,
Senator Thompson.
if I may just respond to that.
Yes, Senator
I would have
Thompson.
been happy to do that had the testimony focused on that. But virtually none of the testimony focused on that. So I feel that if the chair allows testimony on completely unrelated issues, then members have the right to comment on it.
I'm sympathetic to that, Senator Thompson.
Thank you.
Members, from now on, let's focus on the tax policy. Senator Nelson.
Thank you, Mr. Chair. I am interested in focusing on the tax policy, and particularly just three brief comments. One, we mentioned about whether this bill was related to smoking or tax policy, and if, I think Senator Senjum mentioned, is it about tax policy to control behavior? And yes, we do that. That's what tax policy does. Whether it's mortgage interest rates, being deductions for those, or whether it's savings plans like IRAs, Roths, college 529s, deductions for K-12 expenses, dyslexia expenses. We do that in this committee all the time. So let's not kid ourselves. Tax policy is involved in controlling behavior, or we wouldn't say controlling behavior, but we would say incenting behavior or disincenting behavior. So that's just a basic of one of the things we do with tax policy. And I also want to state that I am particularly sensitive to all of our small business owners in this state, and particularly when they take time out of their day to come here and testify before committee, and particularly the many, many ways that our state increases the cost of doing business in Minnesota. I think that is a significant issue, whether it be the way we tax general business property tax, send it right into the general fund. We continue to put barriers in front of our businesses in regards to the cost of doing business in Minnesota. And so I was listening intently to Mr. Walk talk about the part in this bill that actually significantly reduced the tax on the premium cigars. While that is significant, I think the more significant part of this bill is actually in Section 1, which didn't get a lot of discussion, but that is actually striking out in the definition of premium cigar, the fact that it's hand-rolled. And I almost feel that that is really worthy of greater discussion here, because a premium cigar is a very premium cigar in a very distinct hand-rolled way, according to current definition. But I am puzzled that in this bill, which all the testimony was about reducing the tax on these premium cigars, the real issue is the fact that the definition is changing about what a premium cigar is. And so we're taking out the fact, if this bill were to pass, that it's hand-rolled. Suddenly, one could see machine cigars being produced in mass quantity, and while they still might fall under the definition of premium cigar in our legislation, the fact that they're no longer hand-rolled makes them cheaper to produce, more of these produced at a lower cost, which does get into that very market that is so price sensitive. And so I'm most concerned about the deletion of the words hand-rolled in this particular bill.
Senator Senjum, your thoughts on the definition?
Mr. Chair, I would, and maybe council can help me, there's been two individuals that have commented on the definition. I would move that we delete subdivision 13A. Let's take that out of the conversation.
Ms. Pollack, does that accomplish the conversational goal of eliminating and retaining the hand-rolled as a definition of a premium cigar?
Mr. Chair and members, yes, the motion would be to delete Section 1 of the bill.
Senator Senjum moves to delete Section 1.
Yes.
Any questions, members? All those in favor say aye.
Aye.
Opposed, same sign. Motion prevails. Section 1's deleted. Senator Eaton.
Mr. Chair, I was going to pretty much say what Senator Nelson did. I'm sorry.
Very good. Senator Orton.
Thank you, Mr. Chair. I agree that when we look at a tax bill, it has tax policy implications, and we look at the reasons for the tax policy. Why would we deduct the mortgage interest rate? There are good reasons to do that. But then we also don't dismiss the economic impact. And I think that's Senator Senjum's point here, is that there is an adverse economic impact by our tax policy, and he's asking us to explore that, to say that the impacts are hurting Minnesota businesses, hurting the Minnesota economy, keeping us from being able to compete with similar businesses in other states, and can have an impact in hurting jobs. And so I don't think we should dismiss those arguments either. We should recognize the tax policy in both respects, the justification for the current tax and the justification for maybe lowering that tax. And I appreciated Senator Senjum's bringing this bill forward. Thank you, Senator.
Thank you. Anyone else wish to testify on Senate File 1894? Anything else, members?
Mr. Chair, earlier Senator Gazelka asked for some data, and I do have it if you would like it. So quickly, he asked about youth tobacco or youth cigar use. So the Minnesota Adult Tobacco Survey, which is administered by the Minnesota Department of Health, 2014 data shows that in the category of cigar use, cigarillos, and little cigars, so it's not just premium cigars, but the broad category, the use went down from 13% in 2011 to 8.2% in 2014, and that's the first drop that we've seen in that category for youth in many, many years, and it's attributed to the raise in the tax. So just wanted to offer as follow-up to his ask for data.
Thank you, Ms. Waldeck. And I understand it's hard to get good data because the OTP products are all kind of lumped in together, so it's hard to pull out one section or another. Anything else, members? Senator Senjum?
Thank you, Mr. Chair, for having this hearing today. I'm sitting here thinking about how can we even measure that if it's not legal for youth to buy cigars. So I won't go down that path any further. But, Mr. Chair and members, I got involved in this bill from the standpoint of wanting us to think about tax policy, and I've said that several times. I sincerely believe that education's the answer to smoking and smoking cessation. It's not tax policy. It shouldn't be tax policy. It is education, and I don't think there's a person in this room would agree or believe rather that smoking is a good idea. In fact, most of us don't. But nonetheless, to use tax policy as a lever, if you will, to try to control behaviors, I don't think is a proper use of tax policy. I think it ought to be, as I said earlier, about providing fair and equitable funding for government. That ought to be the direction that we take here. If we want to go down the other way, there's a lot of other things that we could tax. There'll be 1, 2, 3, maybe 4 people today killed on Minnesota highways. We wouldn't think of taxing an automobile at the proportional rate of taxation that we're taxing cigars. There will be people entering, maybe people dying, people entering rehab units, families destroyed over alcohol today. We wouldn't think of taxing alcohol, albeit we tax it pretty heavily at a rate proportional to cigars. And so I just wanted to bring this whole issue of proportionality up and taxation relative to taxing behavior versus taxing the proper funding of government.
Well, Senator Senjum, you've piqued the committee's interest with your closing statement, so we're going to hear from a couple of them. But members, we are 20 minutes over already. So Senator Reinhardt first, and then Senator Martin.
I'll be brief. I know I've got constituents waiting upstairs. Senator, I agree with your last comment. I think that proportionality issue is certainly one worth discussing, but I couldn't disagree with the first part of your comments. I think tax policy is entirely about incenting or disincenting behavior. I will concur with Senator Ortman. I think it always has economic consequences that we do want to explore in that conversation, but everything we do in tax committee incents or disincents some sort of behavior. That's why we do it. Thank you.
Senator Marty.
Mr. Chair, Senator Senjum, I think Senator Nelson made very well the case. We often do tax policy. We constantly do tax policy for other policy reasons. We do incent behavior. We do disincent behavior to do that. Some of us do want to see alcohol taxes addressed to address that issue. I don't want to go into it further, but I think Senator Nelson explained very well how many ways we do this already.
Mr. Chair, my final comment would simply be, should we? Should we? Is that the basis for tax policy? And we've had a good discussion today, so thank you.
And Senator Eaton, I missed her, so Senator Eaton.
Thank you. Mr. Chair, I just wanted to say that, yes, we should. Our governor and our Commissioner of Health have stated that we should have a policy of health in all policy, that we should look at what the outcomes of our behavior and our decisions are in the health of our community. And I believe in that very strongly as a nurse. And it's part of being, public health is part of that issue. And that's what we're talking about here. We all pay the price for people's bad decisions. Healthcare is going through the roof. We're paying for people's bad choices, whether it be pizzas or cigarettes or whatever, and we need to continue to educate and work on health in all policies.
Well, it's clear we're going to have continued debate in the legislature. Thank you for the discussion today, Senator Senjum, and to the testifiers, thank you all for coming today. We are meeting tomorrow morning at 8:30, series of members' bills. Chair will lay Senate File 1894 as amended over for possible inclusion.